Looking at these images, the most obvious feature is the diffuse thickening of the stomach wall, particularly involving the lower body and the pyloric antrum. The thickening appears quite irregular, and it seems persistent throughout the examination, which raises some red flags for more serious pathology. The stomach is still able to distend somewhat, but the appearance suggests a lack of normal pliability, almost as if the stomach is stiffened. Now, while this could be caused by a few different things, my initial concern is that this could represent linitis plastica, a form of gastric cancer, where the entire stomach becomes diffusely infiltrated and thickened. This pattern of involvement, involving multiple layers of the stomach wall without forming a clear mass, is highly suggestive of a malignant process like this. But before jumping to conclusions, always good to step back and consider other possibilities, especially when dealing with diffuse thickening like this. Now, in terms of differentials, while linitis plastica is high on the list, gastric lymphoma is another possibility that comes to mind. Lymphomas can infiltrate the stomach in a diffuse manner, just like this. They can sometimes be a little less rigid than gastric adenocarcinoma, but they can mimic the same appearance, so it's always something to consider. What makes lymphoma distinct, though, is its tendency to involve adjacent lymph nodes more frequently. So looking carefully at the surrounding structures for any signs of lymphadenopathy can help steer us in that direction. Another thought: Crohn's disease. While it's more common in the small bowel or colon, Crohn's can involve the stomach in rare cases and cause diffuse wall thickening. But here, I don't really see any of the classic inflammatory changes you'd expect around the stomach, like stranding in the adjacent fat or fistula formation. So, while possible, I'd say it's less likely in this particular case. Inflammatory causes like eosinophilic gastritis could also lead to a similar appearance, especially if there's a history of allergies or eosinophilic disorders. But again, the history and clinical context would need to support that, and from what we have here, I don't see a strong case for it. It's also worth mentioning that metastatic disease like breast or lung cancer could cause thickening like this if it spreads to the stomach. This would be particularly important to consider if the patient had a known history of malignancy. But without that background, we can't make that leap just yet. Another, more benign explanation could be chronic gastritis or peptic ulcer disease, especially if there's been long-standing inflammation or ulceration in the past. However, this pattern feels more infiltrative and diffuse, which isn't typically what we'd expect with an ulcerative process. At this stage, my working diagnosis would still be linitis plastica. The diffuse, irregular thickening and stiffening of the stomach walls, particularly in the distal stomach and pyloric region, fit that picture. I would definitely communicate these findings to the referring clinician and suggest further investigation, likely with endoscopy and biopsy to confirm the diagnosis. If we're thinking of other questions or possible discussions that could come up, we'd probably talk about how to further evaluate this. A staging CT would be helpful to assess for any metastatic disease, or possibly an MRI to get a better view of the gastric wall involvement. And finally, when we think about malignancies, particularly gastric cancer, we often forget the systemic involvement, so checking for signs of ascites, peritoneal metastasis, or distant spread is crucial. I hope that walkthrough gave you some insight into the approach we take when interpreting these kinds of cases. And if you're enjoying these discussions and want to keep learning, make sure to hit that subscribe button on Radiology Made Easy. Let's continue exploring more radiology together.